If you take blood pressure medicine every morning, whether it is Amlodipine, Losartan, or Lisinopril, I want to ask you one simple question. Do you truly know what that small pill is doing inside your body after you swallow it? Not just the name on the bottle, not just the short instruction printed on the pharmacy label. I mean, do you really understand how it affects your blood vessels, your heart, your kidneys, and the warning signs your body may be trying to send you? Because here is the part many older adults never hear clearly enough. These three medicines may all lower blood pressure, but they do not work the same way. They do not cause the same side effects, and they do not carry the same warning signs. Amlodipine can affect the way fluid collects around your ankles and feet. Lisinopril can cause a dry cough that many people mistake for allergies or a lingering cold. Losartan can affect potassium levels in your blood, especially when combined with certain salt substitutes, supplements, or dehydration. And the most concerning part is this. Many people keep taking these medicines for years without ever being told what to watch for, what not to combine them with, or when a small symptom may actually deserve urgent attention. Today, I want to help you understand these medicines in a way that is simple, practical, and easy to remember. By the end of this video, you will know which symptoms are common, which ones should be reported to your doctor, and which warning signs should never be ignored. But first, let me tell you about Richard. Richard was 75 years old, a retired postal worker who had spent most of his life following schedules, checking details, and doing things the right way. Every morning, he took his pills with breakfast. He never skipped a dose. His pill organizer sat on the kitchen counter, filled neatly for the week, so when his doctor added Amlodipine to his blood pressure routine, Richard did not worry. To him, it was just another blood pressure pill. But 3 months later, something changed. His ankles began to swell, his shoes felt tight. By late afternoon, his legs felt heavy, and Richard started to fear that something was going wrong with his heart. Richard became increasingly worried. Every afternoon, swelling around his ankles seemed a little worse. His favorite walking shoes, the pair he had worn for years during his evening walks around the neighborhood, suddenly felt too tight. He found himself sitting down more often, cutting his walks short, and wondering whether his heart was beginning to fail. Instead of enjoying his retirement, he spent hours searching the internet for answers: heart failure, poor circulation, kidney disease. Every search result made him more anxious. What Richard did not know was that his body was not necessarily telling him his heart was getting weaker. It was responding to the way amlodipine works. This is one of the biggest misunderstandings surrounding blood pressure medication. Many people assume that all blood pressure medicines are basically the same, a lower blood pressure, so they must work in the same way, but that could not be further from the truth. Amlodipine belongs to a group of medicines called calcium channel blockers. Its job is to relax the muscles inside your arteries. When those arteries become more relaxed, blood flows through them more easily, reducing the pressure your heart must push against. For millions of people, this medicine works extremely well. It has helped reduce the risk of strokes, heart attacks, and other serious cardiovascular problems. But every medicine has effects beyond its primary purpose, and understanding those effects helps you recognize what is normal and what deserves medical attention. One of the most common side effects of amlodipine is swelling in the feet and ankles. This happens because the arteries relax more than the veins. Blood enters the small blood vessels in your legs more easily, but it does not leave at the same rate. The extra pressure inside those tiny vessels allows fluid to move into the surrounding tissues. That is why your socks may leave deeper marks than usual. Your shoes may suddenly feel tighter by the evening. Your legs may feel heavy after standing or walking for several hours. Many people immediately assume they are retaining too much water or that their kidneys are failing. Others become convinced they are developing heart failure. In many cases, neither assumption is correct. The swelling may simply be a known effect of amlodipine. That does not mean it should be ignored, but it also does not mean you should panic. The most important thing is not to stop taking the medication on your own. Instead, Let your healthcare provider know what you are experiencing. Sometimes a dose adjustment, a different medication, or a simple change in your treatment plan can greatly reduce the swelling while still keeping your blood pressure under good control. That conversation could have saved Richard months of unnecessary worry. There is another mistake I see all the time. People notice the swelling, become frightened, and quietly stop taking their medication without telling anyone. At first, they feel relieved because the swelling slowly improves. But what they do not realize is that their blood pressure may be climbing again in the background. High blood pressure is often called the silent killer for a reason. Most of the time, it causes no pain, no obvious symptoms, and no warning that damage is slowly occurring inside your body. That is why stopping medication without medical guidance can create a much greater risk than the swelling itself. Others make a different mistake. They assume swollen ankles mean they are holding too much water, so they intentionally drink less. Unfortunately, that decision can backfire. Your body still needs proper hydration, especially during hot weather or physical activity. Drinking too little water may leave you dehydrated, causing dizziness, weakness, or even increasing the risk of kidney problems, particularly in older adults. According to the Mayo Clinic, ankle swelling is one of the more common side effects reported with amlodipine. While it is usually not dangerous by itself, any new or worsening swelling should be discussed with your healthcare provider rather than ignored or treated on your own. The good news is that there are often practical solutions. Your doctor may adjust the dosage. In some situations, another blood pressure medication may be added or substituted to reduce the swelling. Some patients also benefit from simple lifestyle adjustments, such as elevating their legs while sitting, avoiding standing for long periods, staying physically active with gentle walking, or wearing properly fitted compression stockings if recommended by their healthcare provider. The key message is simple. Never assume you have to choose between controlling your blood pressure and living comfortably. In many cases, both are possible with the right treatment plan. Now let us move to another medication that surprises many people for a completely different reason. Unlike amlodipine, the most recognized side effect of lisinopril is not swelling. It is a dry, persistent cough. This cough is different from the one you get with a cold. It usually does not produce mucus. It often feels like a constant tickle in the back of your throat. It may become more noticeable at night, interrupting your sleep and leaving you tired during the day. What makes this side effect especially confusing is that it may not begin immediately. Some people develop the cough within days of starting the medication, while others do not notice it for several months. By then, they rarely suspect their blood pressure medicine. Instead, they blame seasonal allergies, dry air, acid reflux, or the lingering effects of a respiratory infection. That is exactly what happened to Margaret, a 72-year-old retiree who loves spending hours tending the colorful flower garden behind her home. Margaret was 72 years old and loved spending her mornings in the garden behind her home. Every day after breakfast, she watered her roses, trimmed the hedges, and enjoyed the fresh air before the neighborhood became busy. So when she developed a dry cough, she blamed the spring pollen without giving it a second thought. The timing seemed too perfect to be a coincidence. She bought over-the-counter allergy medicine, placed an air purifier in her bedroom, and even limited the amount of time she spent outside. Yet the cough refused to go away. Weeks turned into months, and it slowly became part of her daily life. It interrupted conversations, disturbed her sleep, and left her wondering if something much more serious had been overlooked. During one of her routine appointments, her healthcare provider asked a question she had never considered. "When did you start taking lisinopril?" Margaret paused for a moment and mentally traced the timeline. She realized she had started the medication several months before the cough appeared. Until that moment, she had never connected the two. Like many people, she assumed that if a medicine was going to cause a side effect, it would happen within the first few days. She had no idea that this particular cough could develop much later, making the connection much harder to recognize. Lisinopril belongs to a group of medications known as ACE inhibitors. These medicines relax blood vessels by blocking the production of a hormone that normally causes them to tighten. They have helped millions of people control high blood pressure, and in many cases provide additional protection for the heart and kidneys. However, in some individuals, they also increase a naturally occurring substance called bradykinin. As that substance builds up, it can irritate sensitive nerves in the throat, producing the dry, persistent cough that so many people mistake for allergies, acid reflux, or the lingering effects of a cold. Once Margaret and her healthcare provider identified the real cause, they changed her treatment plan, and within a few weeks, the cough gradually disappeared. Before we move on, there is one warning sign. Every person taking Lisinopril should remember a dry cough may be frustrating, but it is usually not dangerous. Swelling of the lips, tongue, face, or throat is an entirely different situation. If those symptoms ever appear, especially if breathing or swallowing becomes difficult, seek emergency medical care immediately. Although this reaction is uncommon, it can become life-threatening in a very short time. Now, there is another blood pressure medication that creates a completely different problem, and surprisingly, it often happens because people are trying to make healthier choices. Let us talk about Losartan. Now, let us talk about Losartan, because this is where many people unknowingly make a mistake while trying to improve their health. A few years ago, Richard's neighbor James was told to reduce the amount of salt in his diet. Like many older adults, he took that advice seriously. At the grocery store, he noticed a salt substitute that promised to be a healthier choice for the heart. It seemed like an easy decision. He sprinkled it on vegetables, soups, eggs, and almost every meal he prepared. What James did not realize was that this product replaced sodium with potassium. At the same time, he had been taking Losartan every day for his blood pressure. He believed he was making two healthy choices, but together they created a problem that no one had explained to him. Losartan belongs to a group of medications called angiotensin receptor blockers, often shortened to ARBs. Like Lisinopril, it relaxes blood vessels and lowers blood pressure, but it works through a different pathway. It is also less likely to cause the persistent dry cough that some people experience with ACE inhibitors. However, Losartan can increase the level of potassium in the blood. For most people, this is not a problem because their healthcare provider monitors blood tests when necessary. The risk appears when extra potassium is added without realizing it. Salt substitutes, electrolyte powders, meal replacement drinks, and certain nutritional supplements may all contain significant amounts of potassium. The difficult part is that high potassium often develops quietly. Some people notice unusual muscle weakness, persistent fatigue, tingling in the hands, leg cramps, or an irregular heartbeat. Others feel almost nothing until the condition becomes much more serious. That is why it is so important not to assume that products labeled as natural or heart healthy are automatically safe to combine with prescription medications. If you are taking Losartan, always tell your healthcare provider about any supplements or salt substitutes you use regularly. A simple conversation today may prevent a much bigger problem tomorrow. There is another situation that deserves just as much attention because it affects thousands of older adults every year. It has nothing to do with food and everything to do with what happens when you become sick or dehydrated. Unfortunately, illness can change the way these medications affect your body. And this is one of the most overlooked topics in blood pressure treatment. Imagine that you come down with a stomach virus. For 2 days, you can barely keep food down. You have been vomiting, dealing with diarrhea, or simply have no appetite. Perhaps it is the middle of summer and you have spent hours outside in the heat without drinking enough water. Your blood pressure medication has not changed, but your body has. As you become dehydrated, medicines like Losartan and Lisinopril may lower your blood pressure more than expected. You may suddenly feel dizzy when standing up, unusually weak, or lightheaded enough to think you might faint. In some cases, dehydration can also place additional stress on the kidneys, making them more vulnerable to injury. That is why many healthcare providers encourage patients to have what is often called a sick day plan. Before you actually become ill, ask your doctor what you should do if you are unable to eat, drink, or stay properly hydrated for more than a day. Should you continue taking your medication as usual? Should you temporarily stop it? At what point should you call the office or seek medical attention? Knowing those answers before you need them can help you make better decisions when you are not feeling your best. There is another common situation that deserves attention because it catches many older adults completely by surprise. Imagine your arthritis flares up, your knees ache, or your back becomes stiff after working in the yard. Like millions of people, you stop by the pharmacy and buy ibuprofen or naproxen. They are sold over the counter, so they seem harmless. However, if you are already taking Losartan or Lisinopril, especially together with a water pill, these pain relievers may reduce blood flow to the kidneys and increase the risk of kidney injury. The danger is not that these medicines are bad on their own. It is the combination that creates the problem. If you regularly need medication for joint or muscle pain, talk with your healthcare provider about safer alternatives that fit your overall treatment plan. One final point is worth remembering. If you often feel dizzy after getting out of bed or standing up from a chair, do not dismiss it as simply getting older. While blood pressure medication can contribute to this feeling, repeated dizziness increases the risk of falls, and even a single fall can lead to a serious injury. There is one more mistake many people make with their blood pressure medication, and it happens every time they look at the numbers on their home monitor. Let us talk about that next. As we come to the end of this video, I hope one message stays with you. Amlodipine, Losartan, and Lisinopril have helped millions of people live longer and reduce the risk of heart attacks, strokes, and other serious complications of high blood pressure. These medications are not something to fear. They are powerful tools when they are used correctly. And when you understand how your body responds to them, paying attention to changes like swollen ankles, a persistent dry cough, unusual dizziness, or any symptom that feels different from your normal routine does not mean becoming fearful. It means becoming an informed partner in your own healthcare. Personally, I believe one of the biggest challenges older adults face today is not a lack of treatment, but a lack of clear information. Many people leave a doctor's appointment with a new prescription, but without fully understanding what to expect over the weeks and months ahead. That uncertainty often leads to unnecessary anxiety, internet searches that create even more confusion, or even the decision to stop a medication without medical advice. If this video helps even one person feel more confident about asking questions, recognizing an important warning sign, or having a better conversation with their healthcare provider, then it has accomplished exactly what it was meant to do. Before we finish, I also want to leave you with an important reminder. The stories of Richard and Margaret were shared as educational examples to help explain situations that many people experience while taking blood pressure medication. Every person's medical history is different, and your symptoms, treatment plan, and health needs may not be the same. Nothing discussed in this video should be considered a personal medical diagnosis or a substitute for advice from your physician or another qualified healthcare professional. Never start, stop, or change any prescription medication without first speaking with a healthcare provider who knows your medical history. If you found today's discussion helpful, I invite you to subscribe and join us for future videos where we break down complex health topics into clear, practical information you can actually use. And before you leave, I would love to hear from you. Which blood pressure medication are you currently taking? And is there a question or experience you would like to share? Your comment may encourage someone else who is quietly facing the very same challenge.